Also at that conference today, the mayors of San Francisco and Philadelphia took part in a discussion about housing and climate change policy. This is 45 Minutes.
Good morning. We are going to get started now. My name is Eugene Lowe. I am a member of the conference staff. I'm on the conference staff. And we are very pleased to see all of you here this morning for this best practice forum on new challenges and solutions to homelessness. It is my pleasure now to introduce the moderator, first moderator for the first part of the program, Kristen Capps, who is a staff writer with the Atlantic City Lab, and he covers housing, architecture, and politics. He has been recently working on stories dealing with the government shutdown and how it is pushing low-income renters to the brink of possible eviction. He has also looked at how landlords nationwide have shut their doors on renters receiving housing assistance. He previously worked as a senior editor for Architect magazine. Kristen.
Thank you so much. Can you hear me out here? Okay, I'm going to introduce my fellow panelists, although I suspect you already know them. Since taking office in January 2016, Mayor Jim Kenney has implemented a progressive agenda that creates more opportunity in every corner of his city, which is Philadelphia. He worked closely with City Council to pass a tax on sweetened beverages, to fund bold anti-poverty initiatives, including the expansion of free quality pre-K, creation of community schools, and the historic investment of hundreds of millions of dollars in parks, recreation centers, playgrounds, and libraries. Finding solutions to the issue of intergenerational poverty and restoring equity in historically underserved neighborhoods has always been and will always be a priority for the mayor. Last year, the City of Philadelphia and its partners opened the Hub of Hope, the first of its kind engagement center that provides a gateway to vital services and care for individuals experiencing homelessness. Mayor Kenney committed to providing over $50 million in new resources to support the city's first housing action plan, the largest investment in affordable housing the city has seen in years. He has also formed an eviction task force that identifies ways to reduce the number of evictions in Philadelphia. Now near the end of his first term, Mayor Kenney continues fighting to ensure Philadelphia is a city that works for all. Mayor London Breed is the 45th mayor of the city and county of San Francisco and the first African-American woman mayor in the city's history. Prior to being elected by voters in the June 2018 election, she served as acting mayor, leading San Francisco following the sudden passage of Mayor Edwin Lee. Mayor Breed is committed to addressing the most critical issues facing San Francisco residents. In her time as mayor, she has enacted initiatives to provide care and shelter for the city's homeless population, building more housing for residents of all income levels, improving public safety, continuing San Francisco's global leadership in combating climate change, and expanding access to economic and workforce development opportunities for local residents, particularly the youth. Mayor Breed served as a member of the Board of Supervisors for 6 years, including the last 3 years as president of the board. During her time on the board, Mayor Breed passed legislation to create more housing along transit corridors and prioritize residents for affordable housing opportunities in their communities. She helped to reform the city's emergency response system, fought for funding for San Francisco's homelessness support network, and enacted the strongest styrofoam ban in the country. Mayor Breed is a native San Franciscan raised by her grandmother in Plaza East Public Housing in the Western Addition. She graduated with honors from Galileo High School and attended the University of California, Davis, earning a Bachelor of Arts degree in Political Science and Public Service with a minor in African American Studies. She went on to earn a master's degree in Public Administration from the University of San Francisco. Okay, thank you. Welcome. Welcome to Washington, D.C., and I suppose as a resident here, I should issue an apology, first of all. I know that we have not been behaving very well. I wanted to talk a little.
It's only one house.
I wanted to talk first about the shutdown. For low-income communities especially, there is a looming cliff. Housing choice vouchers funds expires at the end of next month. Supplemental nutrition assistance program funds expires at the end of the next month, if not before. This is a question for both of you. Are you taking steps now to address this potential pitfall, and what are those steps? I'll start with Mayor Kenney.
Well, the irony of this whole thing is that this administration keeps on doing things to make our jobs more difficult, and at the same time using that excuse to beat us up for the things that we struggle to deal with as a result of their stupid decisions. I mean, gun violence is up. They won't do anything about guns. Affordable housing is, scarce, and they're talking about cutting housing choice vouchers. Everything that they do, they won't fund education, and they complain that we're uneducated. I happen to have Philadelphia's the highest poverty rate in the country, and we struggle with that every day. But I've come to the conclusion that there's no Superman or Superwoman that's flying in from Washington or from the state capitol in Harrisburg that's going to fix any of this stuff until we change, as we did in 2018, change the makeup of a legislative body, and hopefully in 2020 change the makeup of a second body and have a new president. So, I mean, those are the things we need to kind of struggle with and hang on to and deal with on a daily basis. The opioid crisis. I mean, if he could give me $25 billion to help with our opioid crisis, as opposed to building a stupid wall, things would be better. We just have to make sure we take care of ourselves, and that we work with other cities on best practices and share ideas and share information and try to get through this national nightmare that we're going through.
Thank you. I would agree with Mayor Kenney on some of the points that he made, because we are in our cities especially struggling with the opioid crisis that is really linked to why we have the challenges we do on our streets with homelessness. Ultimately, I think, though, it's important that we look at this as an opportunity. This shutdown has been really horrible, but it does highlight the challenges that our country continues to face under this current president. And hopefully, folks will take their passion and the challenges that we're dealing with as an opportunity to make sure that we go to the ballot box and elect a new president to take his place. Ultimately, in San Francisco, we are getting prepared. We actually have, fortunately, some safeguards in place to address some of the challenges with the housing vouchers. We work with many nonprofit agencies that really are responsible for a number of our affordable housing developments, and so there are timelines built into our ability to pay the fees for those particular vouchers. So a couple months will be a time frame in which they will be able to basically wait until they receive payment. But we have budget reserves. We'll, if necessary, for some of our programs to help address the challenges with CalFresh and some of the other things that we provide. We will do what we need to do, but it's not as if we can do this forever. We can't, it's not sustainable. And the sad reality is, although with the workers, and we're working on ways in which we, in the state of California, people are able to collect unemployment insurance, and we're looking at a gap funding to loan people money, as well as how are we going to help make sure that they're able to pay their insurance as well, because they've been unemployed for a time period. But ultimately, the biggest concern that I have is whether or not we're going to be able to recoup the cost for those housing vouchers, for our food programs, and what's going to happen once this shutdown ends, if ever. This is going to be a real challenge for us, but we are making plans so that people don't get evicted. Right. Because even though they're nonprofit housing providers, that we can work with and they can wait for payments, and we have budget reserves that we can tap into and provide support, it's not sustainable. Long term, it's just not sustainable. And my biggest concern is as we start to draw down on budget reserves, as we force these nonprofits to wait for payments, and in some cases they may or may not receive payments, what happens if we don't get this money back? So I think that there's a lot of work to do, not just in places like California, but places all over the country. I'm sure all cities all over the countries with both Democratic and Republican mayors are dealing with some of the same challenges. And I do think that it's important that we really come together and really hold our federal elected officials accountable to the people that they represent. Because again, this is not sustainable. But we are making the appropriate plans in order to address it. We're fortunate in San Francisco that the economy is good. We have a 2.3% unemployment rate, but we still have a large homeless population because of this opioid crisis and people suffering from mental health issues. And I'd much rather spend my time as mayor on addressing those issues than, dealing with the effects of the policies that continue to wreak havoc on our cities here that are coming out of Washington, D.C.
Thank you for that answer. Mayor Kenny, Latinos and Latinas represent about 15% of the population of Philadelphia, and they are, as I understand, the poorest minority group in Philadelphia. Yet they can hardly be found in the shelter system. They're also underrepresented in the housing choice voucher system. It's something that some advocates describe as the Latinx housing or Latinx homeless paradox. How are you able to reach these populations with services they need if they're not coming to what the city has to offer?
Well, you have to work with partners, nonprofit partners for the most part, and that's the first thing you have to do with homeless folks is you have to not be angry at them and not be like the business community sometimes is angry that they're there and get rid of these people and get them off the street and we don't care where they go. Well, you have to get to the mindset that these human beings who need our assistance for whatever reason, whether it's some kind of catastrophic issue that's affected their lives or drug addiction or mental health, that they're there, and we have to figure out a way to approach them with the business community, with our nonprofits, and with our other folks working in this environment to get them into a safe space. We work in certain areas of our city. We work with our nonprofits that are particularly Latinx oriented or created to reach through. And the other problem, frankly, is that with our undocumented immigrants, because of the nonsense with ICE and with all the other stuff, it's even harder because people are even going deeper down, into the basement or into the closet and not wanting to reach out for help. But we had an additional issue relative to Hurricane Maria,
right,
where we had people from Puerto Rico that came to Philadelphia. I mean, what you normally expect the national government to do on all these kinds of issues, they just abdicate and refuse to do it, and it winds up falling to the cities to do it. We're the most visible and approachable and reachable people as
right,
mayors and as city council. So we wind up having to be the service provider of last resort. But we have a number of active Latinx nonprofits who work in the communities on the grassroots level that we work with on a regular basis to address these problems that we're dealing with.
Mayor Breed, I want to ask you about a different kind of paradox. The city of San Francisco hands out almost 4.5 million syringes every year through its needle exchange program. That means you are preventing one health crisis, but it's one that is invisible in a sense. You can't see an HIV outbreak that doesn't happen, but you can see the needles on the ground. So how do you deal with the political problem that needles cause while maintaining support for the health crisis that needles avert?
Well, I will also say, yes, it's possible that having needles found in playgrounds and other places where someone could potentially get plucked by one of them is creating another public health crisis, and I understand that. And I'm beyond frustrated about some of the challenges with people who unfortunately suffer from substance abuse disorder. And at the end of the day, part of what we've been able to do, we hire people specifically to go around and pick up and clean up needles in those particular areas. And the reason why I have been, just a big supporter of trying to implement safe injection sites in my city has everything to do with not only trying to get the needles off of the streets, trying to bring people indoors, because it's something, of course, we all know that no one wants to see, but ultimately, when someone is ready to get help, we have to be able to meet them where they are. We're not going to stop a drug addict from using drugs. People who have challenges with addiction are going to do whatever it takes to get access to whatever they need to get their fix. That's just the reality. But at the end of the day, what happens when that person is coming into a place where they're treated with respect, where they're not judged, but more importantly, when they are ready, when it is time, they can go to a place that they've been going to and probably shooting up for years or months or what have you, and that's the same place they're going to go and ask for help. And we got to be able to get that person into help right away. So I think that, it works in other countries. We know we haven't been able to open one. I know Seattle is interested in doing the same thing, and there are a few other cities in the United States who want to open safe injection sites, and we know some major challenges with federal law. We have one of our senators introduced a bill in Sacramento that the governor, who's now gone, Jerry Brown, vetoed, and I think that Governor Gavin Newsom will probably be more open to it, so we'll be able to cross a barrier on the state level, I believe. I'm optimistic about the possibility of doing it. And, I wasn't a big supporter of basically, when you think about it, the first thing you think is, why are we providing a place for people to shoot up and making it more convenient for them to get high? And again, it's not just about that, and ultimately, I think that what we're doing isn't working, and this could potentially be part of the solution, but more importantly, getting people help is the ultimate goal of where I'd like to get, so that there are less people using drugs.
Just let me add, we have one particular neighborhood in Philadelphia that's kind of the epicenter of our heroin and opioid issue in Kensington and Fair Hill. And what we've done is we've instituted and installed a number of needle deposit boxes near the L stops and areas where people congregate, and that has actually helped with the number of reducing the number of syringes and needles that are on the ground. We've also done we've done every 2 months or so a major cleanup in that area to and we do have people who go around and are trained to retrieve the needles. As far as the safe injection sites are concerned, I recognize that people's reaction to that is why would we do this? As Mayor Breed said, why would we do this? Because we want to keep people alive. We had over 1,200 overdose deaths last year that would have been reduced substantially if we had a location that people could go safely and inject if they overdosed. Someone was there for them, nursing staff, medical staff, addiction treatment people to kind of get their arms around these folks and try to get them in the right direction. If you're shooting up under a railroad bridge or in an alley somewhere and you fall out, you're probably going to die. And I think our cities have the responsibility to keep people alive, basically, until we have the opportunity to get to them. The other issue, and what I've been reading about the research, that marijuana, cannabis legalization and allowing it to be used for medical treatment with people who are addicted has been very effective. And I think in Pennsylvania, for example, it's extremely hypocritical that the state of Pennsylvania sponsors, sells, taxes, and promotes alcohol in their own state store system. It's not even a private system. The government runs the alcohol sales system in Pennsylvania, and tend to be recoil that somehow marijuana should not be even talked about when it is effective in treating people with opioid addiction. I think and we saw in Massachusetts, and even from a revenue standpoint, Pennsylvania, no one wants to raise taxes to pay for education or infrastructure or transportation because, they signed that Grover Norquist pledge how many years ago, and they'll never raise taxes under any circumstances, even if there's a major calamity. You don't have to raise taxes by legalizing recreational marijuana. You can get a revenue stream that would make sense because people are buying it underground anyway. I mean, and I saw in Massachusetts when they opened the first recreational spot, I mean, everybody in line was my age or older. So it was like all these Vietnam veterans with their hats on, they were all lining up. I mean, it's crazy to have a system where you sell alcohol and you turn your nose up at the cannabis part of it. So safe injection sites are difficult because the first thing that happens, our own U.S. attorney, who I happen to like and respect very much, is threatening to lock everybody up for saving people's lives. And we are also having a complicated debate with our law department about whether we can sponsor it, whether it's a nonprofit can run it. Former Governor Rendell has been on the forefront of being the front guy who has offered to be arrested first. So that's good. I'm glad he's made that offer because I don't have to lock me up. So those are the things that we need to do sometimes outside the box that work. It works in Vancouver, it works in Europe, it works in Montreal and Toronto. It works.
There's a geographic problem associated with needle exchange too. In San Francisco, in a conversation with the San Francisco Chronicle, a supervisor recently alleged that the city is engaged in a conspiracy to kind of consolidate the ills in District 6, which includes the Tenderloin. So I would ask you, Mayor Breed, I guess first, are you engaged in a conspiracy? And, and second, can you point to policies that address the very real problem that the crisis is so concentrated in one part of the city?
Yeah, and I will just state, first of all, unlike the supervisor who made those allegations, I actually was born and raised in San Francisco, and many of the people who live in the Tenderloin, which is in close proximity to where I grew up, those are a lot of people that I grew up with. So many people, so many of my friends and family members, sadly, have ended up in the criminal justice system, ended up on have ended up on drugs, and unfortunately, in some instances, they've ended up dead. And so this is work that I've been focused on for most of my career, ever since I had really the opportunity, which I never thought I would, to even go to college, coming from a really challenging community. So I take it personal. And the fact is, the Tenderloin, the neighborhood of the Tenderloin, the housing opportunities that exist there are a lot of single-room occupancy hotels. They basically are, rooms and shared bathroom situations, and they're a lot more affordable. And in fact, a lot of folks end up in the Tenderloin because it's more affordable, because sadly they've been pushed out of a lot of their neighborhoods around San Francisco. And also, what the city does in order to try and house a lot of homeless individuals, we work with the people who own these buildings, and we take out master leases. So we basically rent the whole building in order to basically get homeless people off the streets into housing. So there just so happens to be just a concentration of these particular rooms that are available in order to house people that are located in the Tenderloin. But let me also say there is a lot of bad behavior, because as a kid, when I was growing up, it was easy to basically, when you considered what you would do in life, I mean, you could go down to the Tenderloin and sell drugs.
Right,
and that was an option, and it still is an option. And part of what I've already started to do is spend a lot of time in the Tenderloin, and I've been running into a lot of friends and family members, and it's been great because, they feel like there's hope. And I'm like, I want to help, but I also want you to meet me halfway. So even the people who I know personally who are out there selling drugs, I'm like, look, I want to work with you. We will give you a job opportunity where you can make just as much money. But you know what? We're going to start cracking down. You can't be out here selling drugs. That's illegal. And unfortunately, I believe in criminal justice reform. I don't like locking up people because they're selling drugs. But what choice do we have, especially if we give you an alternative? And so some of those folks have taken us up on our offer. Some of them haven't. And so we've been really concentrating, on trying to get rid of, what we know is the distribution of drugs, and really focus on trying to shine a light on this community, work with the people that are in this community, and meet them where they are. And a lot of folks, you see a lot of people in the Tenderloin who are just hanging out. This is their neighborhood too. They're just hanging out in front of their building. They don't want to be cooped up in the building all day. And, you know, I mean, they deserve to have a place and enjoy their neighborhood just as much as anyone else. And so I think there are a lot of challenges with this particular neighborhood. There always has been challenges with the Tenderloin, but since I've been mayor for the past 6 months, I've spent a considerable amount of my time really dedicated to this particular area, and in some spots we've been able to really have an impact and clean it up, and we're hearing positive feedback from a lot of people who live there. And the other thing, and the last thing I'll say is, part of it is, yes, we can spend all this money on our poop patrol, on our needle pickup, on our folks who are cleaning the streets, a lot of formerly homeless individuals that we hire and provide housing for to help us clean up the street. We can do all these great things, but ultimately, you know, we have to take responsibility. And this is what I say to a lot of residents, especially when I'm walking around in the neighborhoods, and especially when they throw something on the ground right in front of me. Pick it up. Clean up after yourselves. We have these pit stops where people can use the bathroom. This guy was urinating on a tree. I'm like, dude, the bathroom's not even a block away. Oh, I'm sorry, Mayor, I'm sorry. And here's the thing. We have to talk to one another and engage in conversation to try and work with people because ultimately it's our responsibility to take care of our communities and to hold one another accountable. That's what I learned growing up, even in public housing. You know, you cleaned up after yourself, you looked out for one another. In addition to the city doing its part, you know, it's gonna require a lot of effort from the residents as well.
Thank you. The annual canvassing for people experiencing homelessness began last night in Philadelphia, and those point-in-time counts are, as we know, difficult to conduct and less than ideal in a lot of ways. There are a lot of people who are experiencing homelessness that are not captured in these numbers. In Philadelphia, for example, the city reports that around 2,700 children are experiencing homelessness, but the Philadelphia School District has a different number. They say that that number is closer to 7,200. That's a really big disparity. Right. How can Philadelphia improve this count?
Well, the count as of yesterday was about 990. We've been as high as 1,300. Now, these are people that are actually out on the street in the cold. We do get about 15,000 requests a year for some type of housing insecurity issues that people are going through, and we don't count, sadly, we don't count the couch surfers. They're not captured in those numbers, so we don't know. And young people, youth homelessness, about 30 to 35% are LGBT, and we have a number of organizations that are trying to address that issue. The numbers are hard because it varies based on the time of year. I mean, in the summertime, obviously the numbers are higher. As we get colder, we have code blues. People are forced; it can be forced into shelter. We did as you mentioned earlier, the Hub of Hope with SEPTA and with the business community, so that people during the day can have a place to go and get a shower, wash their clothes, get a cup of coffee or a meal. This is not like a pure science when you're dealing with human beings, we try to get our arms around the numbers as best we can and address the issues. In Philadelphia, we have a less expensive housing stock. So compared to San Francisco or Boston or Washington or New York, our housing costs are lower. So we tend to have more people indoors, either in shelter or in transitional housing or in permanent housing. And if you expand the shelter beds without expanding the other forms of transitional and then permanent, you wind up with a parking lot of shelter beds where people don't move on to the next level. I don't have an answer to how we determine the actual true count other than counting people that we can see on the street and also making estimates as to those folks who are either facing housing insecurity or living with somebody else or living in places that we can't get to count. So I don't know the answer to your question as to how we can be more accurate, I thought it was all you clapping for. No.
Great answer.
So yeah, great answer. I don't know the ultimate. All of this is difficult to scientifically deal with because you're dealing with human beings who are in different circumstances and in different times of the year, different times in their life are in different circumstances. So our street numbers are pretty steady. We've had an increase of about 400 or so because of the opioid issue in Kensington and Fairhill, and we're doing our best to deal with it.
In a moment, we'll open up this to questions from the audience. I'd ask you to raise your hand and then approach one of the microphones in the room when I call on you. But first, maybe a kind of lightning round to address the levels that you described, Mayor Kenney. I'd like both of you to answer about your biggest immediate need, and whether that is in shelter beds, transitional supportive housing, permanent supportive housing, or some other kind of housing I'm not thinking of.
Good.
I would say shelter beds, because I know people say housing and we need more housing, and yes, we always need housing, and we have to do a better job with housing production all over the state of California in particular, because about 24% of the homeless population that exists in this country is in California. But ultimately, again, because of our challenges with this opioid crisis and the people who are suffering from mental health, we need more shelter beds in order to have a place for people to go no matter their condition.
Right.
And that is a big need, and I have a plan to add another 1,000 shelter beds to our city. We're working on that. We've already done 338 since I've become mayor. And so I introduced legislation to get rid of the bureaucratic layers that make it difficult to get a shelter built in different communities. And because people say clean up in the streets and help the homeless, and then you want to put a shelter in their neighborhood, and it's like, I don't want this in my neighborhood. We have to do better, and everyone has to share in on the responsibility. And so the legislation I proposed will give us the ability to not have to go through the same public process that make it difficult for us to make it happen. It'll cut back on the time by at least around 6 months to do that. So I would say shelter beds.
I think, and I agree with the mayor. However, I think it's all of it. It's not just the shelter beds, it's the transitional housing, it's the permanent housing, it's the housing trust fund. We did 6,000 housing repairs last year on roofs and heating systems and things to keep people in their homes so they don't wind up homeless in the first place. We have a pretty robust tax abatement that's been in place in Philadelphia for the last 20, 25 years, and what we've decided to do is to dedicate the new real estate tax revenue of those houses going back, those businesses and homes going back on the tax rolls after 10 years of the tax abatement. That money's going to go to building affordable housing. That's about $53 million this coming year, and we've pledged another 18 to 20 million from general fund revenues to improve on that number. It's working with PHA, Philadelphia Housing Authority, and the state organized, federally funded housing agency that does a ton of work in providing affordable housing for seniors, for families, for veterans. It's the whole kind of panoply of opportunities to get people into safe housing, I do think it's all of it. I don't think there's this one area where we can concentrate on without affecting the other areas that we're dealing with. And in the end, I mean, I know this seems like the really big cosmic picture. It's funding education. I mean, you have to fund schools in order to get a generation of people that are educated enough and trained enough to have the ability to get a job that sustains a family and pays taxes and buys their own home, as opposed to dealing with what we're dealing with now. And I know that's we started off with the beverage tax. We were successful in passing that. We have 4,000 kids in quality pre-K, 3 and 4-year-olds. We're seeing the benefits of that in kindergarten, first grade, second grade. We've created a community school network where we've given away 90,000 pounds of food last year, nutritional food for people, and trying to get our arms around our infrastructure when it comes to rec centers and libraries, so that people have safe, decent places to go to after school and during the day. It's the whole mishmash of stuff that you need to address in order to get that young man or young adult from standing on a corner with a pistol in his belt, selling drugs, as opposed to going off, graduating high school, going to college, and having a job where he doesn't have to put himself in harm's way. There's no good end to his life. He's going to either be, he's not going to meet his potential, or he's going to be locked up, or he's going to get killed. And the reason that happened is we did not do a good enough job in educating that young person from the very beginning.
Okay, I'll open it up to some questions. Ma'am, please.
So thank you for the work you're doing on this issue. As mayors of major metropolitan cities, obviously folks experiencing homelessness don't stop at your city borders. There's a lot of folks in the smaller communities, neighboring communities. I'm the mayor of Everett, Washington. We're just north of Seattle. So what are you doing on a regional level to address this and empower the local smaller communities to come up with solutions that may look very different than what you're doing in the larger cities?
Well, I'm glad you asked that question because, in fact, we actually are working on a regional approach, and we'll be signing an agreement that outlines a lot of the things that we could be doing in the Bay Area specifically that I think can transfer to the entire state of California. And I know this is the U.S. Conference of Mayors, and we're talking about other cities and other states, but we're really focusing on, even the smaller cities. We've been participating in a group called CASA, which is bringing together a number of people in the advocacy community, the business community, the tech industry, elected officials, all over to talk about what are we going to do, like from a Bay Area perspective for housing. And we put together a really great plan, which we're going to be signing and also proposing to our state legislators to implement some of these policy decisions and allocate resources so that we all are doing a better job of building more housing as we increase the economy throughout the Bay Area. So for example, in the Bay Area during around 2015 when we were, the economy was booming, all the tech folks were coming to the area, we were creating, 8 jobs for every 1 unit of housing. And so part of, what we have to do is make sure that it's not just San Francisco that has shelter beds, it's not just San Francisco that's building the housing, everyone has to take part. And so that's why I push for a lot of changes to our state law that would have allowed something that I did on a local level so that we could build more housing and increase the height along transit corridors. And I pushed for, I supported a state bill, and the state bill didn't make it out because a lot of folks, protested and didn't want to see that happen. And so it's just working together, coming together, and basically making the time to come up with the right plans. And all the cities had their own things that they were doing, and by coming together and talking about what's working in a particular area and what are some proposals that we could suggest to change state law and to get more funding, in terms of a partnership, so that even places like Brisbane or some of the smaller cities like Daly City and other places, so that they can also do more and get more resources to do more. That's an important part of our ability to be able to get to a better place eventually, because it just won't be our city alone that gets there. So it's just really working together and making the attempts to do so.
And despite Philadelphia's poverty level, the southeast region of Pennsylvania is pretty wealthy and pretty well off. If we could just get our surrounding county neighbors to kind of bear the burden of their own homeless folks, their own addicted folks, as opposed to what's been legendary where, suburban police will put people in a car, drive them to the closest transit stop and give them a token and send them into Center City. So a lot of what our homeless and addicted population in Kensington and other neighborhoods are not even Philadelphia residents. They're residents from Delaware County, Montgomery County, Bucks County, which are not really taking on the load of helping us commensurate with their populations to pay for and address these issues. So we become the kind of the end place where people wind up in addiction or in homelessness. So because they know the services are there. If you're not providing services in your suburban county, people have nowhere to go to get those services other than Philadelphia, and we bear the additional burden of having to deal with our suburban population that are in distress. So I don't have an answer to that other than having the state capital provide more funding for all of us to deal with these problems.
Thank you for your question. Ma'am, do you have a question? We're not going to get through everyone in line. Unfortunately, Joe Biden cut into our time starting off. Very rude.
Uncle Joe. Yeah.
Thank you. My name's Kim Cook. I'm the Director of Art and Civic Engagement for Burning Man Project. And I work in San Francisco. I live in Oakland, but I spent 5 years in Philadelphia at the Nonprofit Finance Fund and know it well, and was just visiting and hearing about what's happening in Kensington, which, 8 years ago, Kensington was the promise of, redevelopment. So very sorry to hear what's happened there.
Well, actually, Kensington is, believe it or not, is starting to gentrify in certain areas. Now, gentrification obviously is not a popular word with everybody, but you can, we have drug dealers or, prostitutes on a corner, and across the street we have a new coffee shop with Wi-Fi. These young people who invest in both neighborhood businesses and residents tend to go into pioneering kind of situations where they're not afraid to move into a neighborhood and to make it better. But the key for us is not having the rest of the people pushed out when the wave of new folks come, and that's part of our.
So my question,
Ma'am, we're
yes.
we're on a very tight schedule, so I'd ask you to pose
My
a question.
question has to do with the references you've made to both mental health and opioid addiction, and looking at sort of the causal upstream services and what you're able to do in that arena.
Will one of you like to answer that?
Yeah, I'll just answer that by saying, like, for example, specifically with mental illness, I just think it's time that this country has a real conversation about solutions to address the challenges that exist with those suffering from mental illness. And we know that in the case of what's happening, in our city, drug addiction that brings on the psychosis that sometimes is not reversible. And part of one of the things that we're doing is legislation just passed from the state, SB 1045 in the state of California, which gives us another tool that would allow us to conserve an individual to get them help, to get them into a mental health stabilization bed. But ultimately, we want to get them treated and we want to get them into permanent housing. It's a process, it's expensive. Mental health stabilization beds are expensive, but it has to be done, because what you see is our prisons or our jails are being used to basically, you see someone on the street, something happens, they get arrested, there's, or they're taken to San Francisco General, there's a 72-hour hold, and all of a sudden they're back on the streets in the same condition, and that's not helping anyone. And so ultimately, just really changing how we approach this and be willing to make the hard decisions, even though I know it's not popular to say you want to take away someone's rights to make decisions for themselves, but at the same time, we're talking about people who are not capable of making good, healthy choices. And the goal is not to completely institutionalize anyone, but more importantly, to get them to a place where they are able to be healthy and get the supportive services they need. And in many instances, we're talking about people who just aren't even in the condition to, even clean themselves. And we're allowing them to just be because they have rights. And that's some of the work we're doing around mental health in particular in San Francisco, and I'm getting the huffing and the puffing over here, so I'll just be quiet.
Well, no, I want to talk about it all day. We are really out of time, but I want to get one last question in from Mayor Jacob Frey of Minneapolis, who was, as you may know, just able to usher through an ambitious zoning platform. Mayor Frey.
Thank you very much. Jacob Frey, Mayor of Minneapolis. Wanted to ask a question about unsheltered homelessness. We recently had a pretty significant homeless encampment in our city that we were able to transition successfully to a navigation center, but there's a good chance that they will pop up again. And so what are you doing about homeless encampments? How do you work through the process? Obviously, it's a difficult one.
Well, we emptied out a train track area which was below grade, where people were living for 20, 30 years, injecting drugs and dying on the tracks. We had 12 to 14 people a year die of overdoses and that. So the community there wanted us to remove those folks from there. And once we did, which we knew was going to happen, they went and camped in other places. So we had 4 major encampments in one particular neighborhood. They went underneath the train trestles, and people are really helpful, and they want to be nice. But when you bring people tents and heaters and furniture, and it's just you're entrenching them even more in there. So we moved 3 encampments so far. We're moving the last January 30th to 31st. But there's rules we have to follow. We have to engage first. We have to put signage up. We have to make sure that we have a place for them to go. So even if they refuse to go there, we have to have 1-for-1 respite or treatment beds. And we've been successful in removing 3 of those encampments. The 4th one is the most entrenched. It's got the most people, and it's got the most kind of crazy activity going on in there, and we have to be a little more careful with this particular group. But we are ready now. We have enough beds for them. We have places for them to go, and then on the last day or so of January, we're going to move the last encampment. But people from the suburbs generally who want to be helpful, who are representing in church groups or things, who want to feed, they want to feed people on the street, it's laudable, and it's Christian, and it's religious, and it's wonderful, but it's not helpful because it just enables people to stay out there even longer. It's the same thing with, you walk down the street, you want to give a guy $10. That's the last thing you should probably do, is you should donate the $10 to some group that's going to help actually do something as opposed to allowing him to continue his addiction.
Thank you, Mayor Fry. Thank you, Mayor Kenny. Thank you, Mayor Breed. And thank all of you for joining us this morning.
Today is day 34 of the partial government shutdown. The